Hello, I'm Urologist Erdem Akkaya. Today I will briefly talk about the relationship between herniated disc and erectile dysfunction. What is a herniated disc? Our spine is a system that carries the weight of our whole body on our back. Through this spine pass the nerves that are distributed throughout the body. There are 33 small bones called vertebrae in this spine. Between these 33 bones, there are structures called discs that buffer the weight like a cushion, prevent two bones from rubbing against each other and increase the mobility of the spine. If these discs lose their form over time, which may be due to age, heavy lifting or reverse movement, these discs herniate and put pressure on the nerve root coming out between the two vertebrae. And when there is pressure on the nerve cannot fully fulfill its functions and pain occurs. The patient may have back, side pain, leg and hip pain. Later, loss of sensation in the foot and loss of strength may occur. This can occur very quickly or gradually. So what are the urological functions of those nerves? Without those nerves, neither erection, ejaculation nor urination would occur. Of course, when there is partial damage to these nerves, there may be partial complaints. How can this happen quickly? For example, the patient had a traffic accident and suffered spinal trauma in the lumbar region. The patient may not be able to urinate at all and may be stuck with a catheter. For example, if the patient has erectile dysfunction, complaints about urination and loss of sensation and weakness in the legs, we can think that these complaints may be neurological and refer them to a neurology or physical therapy physician. In the meantime, we can support the patient with erection quality enhancing drugs. But frankly, this is one of the reasons that rarely come to mind in urology. Let's look at the studies on this subject. In the studies, they operated on patients with herniated disc and erectile dysfunction. They evaluated how much erectile dysfunction and premature ejaculation improved after surgery. Obviously, the common result of this study is that patients with erectile dysfunction and herniated disc under the age of 45 can improve about their complaints of erectile dysfunction and premature ejaculation after surgery. But patients over the age of 50 usually don't see serious benefit after surgery for erectile dysfunction due to herniated disc. There is also an interesting case report. A 17-year-old person falls off a horse and then develops a herniated disc. And he had erectile dysfunction for 17 years after falling off the horse. After 17 years, at the age of 35, he underwent surgery for the herniated disc. And the patient's erection and sexual functions improve. This is an interesting case in scientific terms. As I said, erectile dysfunction can sometimes occur due to a herniated disc, especially in young people. These people may also benefit from surgery. Of course, the most important thing is to be careful when lifting weights and doing sports to protect our vertebrae and discs. Some movements, especially the ones I have seen, such as deadlifts and squats, are risky if done incorrectly. The force on the vertebrae really changes a lot. Especially as it was explained to us in occupational safety, when you try to pick up something weighing 4 kilos from the ground, there can be a pressure of up to 400 kilos on your spine. This happens according to the angle of your position on your spine. If you try to do it by hunching your back, when you pick up something from the floor, there is a serious load. If you try to pick up something from the ground by bending your knees, your waist is more upright, and this weight on your waist is more balanced and evenly distributed. You really need to listen to what the athletes say and do the movements correctly. Or this also happens when working in the workplace. In workplaces, people are given opportunities to work in a more ergonomic way. For example, in factories abroad, the working conditions of workers can be very different from ours. Because they want to prevent the development of occupational accidents. Since the workplace is responsible for the work-related damages that occur in the body of the person over time, the legal obligations belong to the workplaces. At the same time, the workplace is also responsible for the damages caused to the person by the substances used in the workplace. The field of occupational safety and health actually deals with this, but these should always be taken into consideration. I digressed a little bit, but this is how lumbar disc herniation and erectile dysfunction are in general. Thank you for listening, best regards.